would be a really good time to sit down and give you some advice about what I would do if I was in your position. Hello, third year medical student, or if you're making that transition from preclinical to clinical, welcome. It is lovely to meet you. I thought it would be a really good time to sit down and give you some advice about what I would do if I was having to do my first clinical placement again without being able to have as much patient contact. One of the things I wanted to say was when you're just starting out and you're doing your third year or your first clinical placement, one of the best things that you need to find out is what is normal. And so how to do all of these examinations and get an understanding of what a normal heart sound is and what a normal lung sound is. And therefore, then you can identify when things are abnormal. So actually not being able to practice on patients isn't the most terrible thing because you can practice on your readily available colleagues. So you can practice with your friends, with your housemates, with your family members, whoever you've got around. Try and do them under timed conditions once you've got an understanding of what exactly you need to do and why you're doing them. So hopefully that will allow you to build up your skill without having to go to placement. Sorry, so another helpful thought just popped into my head. I really should have scripted this video. It is just all over the place. This is like insight into my brain. Anyway, so the thing that I wanted to mention was visualization. So it's a really, really great way of practicing, performing clinical examinations and things like that, or procedures in your mind if you're not able to actually do them with a person or with a model or something. So it's basically you just sort of run through the steps of the procedure or the examination and you fully imagine yourself doing it. So it's like a thing that lots of, athletes and stuff do when they're trying to like prepare for a big game. And, OSCEs or clinical examinations, however they're called in your university, they're kind of like that, they are a performance. And so if you walk through the steps in your mind, I find that it really helps get you comfortable and you can kind of imagine yourself almost successfully doing it, and it kind of like positively motivates you. I don't know. I'm sure there's loads of stuff about it, like, law of attraction and positive thinking and stuff like that. But visualization is something that people have said is really, really useful. And this is a tip that a senior of mine gave me when I was in my third year. And I just found it so, so useful. So there's this app called OSCE Revision, which I think is like an MDU app or something. Basically what it does is it's got like a checklist of all the things that you need for different examinations. And it just runs through them so well. And so you can either use that with another person. So you can like give it to them and then they can check it off. So they don't even have to be medical because like literally everything is there. It'll be like auscultate the chest, so if you listen to the chest then they'll give you a tick. So it's quite straightforward. It's also got a timer on it, so you can time how long you're doing the exam. And another way you can use it is if you want to visualize it, go through it in your mind, and then you can check off for yourself what you did and what you didn't do. Another way you can use the app, sometimes before bed, I would just sort of flick through it and revise the steps of the examination. It literally takes like 30 seconds and it's much more productive 30 seconds than being on Instagram before bed, which is what I currently do. I know that everyone's placements are kind of different lengths and will vary so much depending on where you're going. But what I would say is have a look at how long your placement is. I would allocate each week to a particular specialty. So say it's a 10-week placement and you've got 8 different specialties to do within medicine, I would allocate a particular week to each specialty. But some specialties, you'll probably know, have quite a lot to cover. So I know that gastroenterology, for example, that's a huge topic. You're probably not going to finish it in a week. So you might need 2 weeks for that one. Also things like neurology. It took me a really long time to wrap my head around it. A lot of time spent just like watching videos over and over and over again, trying to get it in my head. And so that's probably going to take a little bit longer than a week as well. Whereas there might be some which don't take that long. So like musculoskeletal, I remember we had in our third year, but we actually had like a whole other placement on it later in our 5th year. So we didn't really have a lot to cover within that topic. So we could finish that in a few days. So it should hopefully all balance out in the end. So it's a good idea before you start your placement, or just once you have begun, once you've found your feet, to sit down and allocate some particular specialties to each week. So another thing that you can do to try and plan your specialties per week is try and get it to align with the rest of the teaching that you're having from your medical school. So say you've got some case discussions or some teaching based upon respiratory that week, and you've got 2 or 3, then you might find that that's a great week to do some respiratory learning on your own time, because it will kind of make sure that you're not doing double work in a sense, and it'll hopefully solidify the whole topic for you in your mind. So at the start, I remember I was super slow and I was getting really worried. I was like, oh my god, it's taking me like so many hours to do such a small topic. But as you keep doing more and more topics and you find your system and you find your flow, you will find that you're a lot faster. This is a very different degree to what you were used to before, at least I definitely found that. And so just remember that it's okay if you haven't yet found your system of working and studying. I think no one has ever got it completely down. If you have, then I applaud you, but I still don't feel like I have a perfect system. I think it's always changing. And so make sure that you allow yourself a bit of time to understand that flow for yourself and get into it. So I remember another thing that I found when I was starting out was that I would sort of go to ward round, or I would go to some teaching, and over the course of the day I would like write down all the terms that I didn't understand, and then by the end of the day I would have this like massive long A4 sheet of words that I just didn't make any sense to me, and I would like try and task myself with finding out what they meant when I went home. And inevitably there was no way that I could Google all of them and actually capture anything meaningful from a quick Google search in like half an hour. And so I quickly realized that that's not a very useful thing to do, and it's not a great use of my time. And instead, if I had just focused that time on one particular condition or one particular topic, I would have gained a lot more than just trying to helter-skelter, like gain little bits of information about random stuff, half of which probably wasn't even relevant to my learning at that point. And so that's why I was saying, if you have that structure and you have that system of, okay, I'm going to do this particular specialty this week and I'm going to focus on this particular condition on this day, or these two conditions on this day, then you're less likely to kind of be tempted to go Google random stuff that isn't really useful to you, because that temptation is very real. When, you know, someone says something that you don't understand, your instinct is that you want to find out what it is, and you definitely should sometimes. But I think that if you're finding you've got a massive long list of stuff and it's taking up a lot of your time or it's stressing you out, I would put that to the side. And it's dark again. So say you had some teaching on pleural effusion and then you went home and you wanted to learn more about it. So I would go home, I would watch the osmosis video about that particular topic. And the first time I would watch it was I would just kind of watch it, kind of like I was watching any YouTube video. I would sort of eat a snack or put my feet up or just chill out, watch it in bed sometimes. And that's just to give you a basic understanding of the whole thing. Then what I would do was I would sit down and I would actually go, you know, frame by frame, and I would make notes on the video, and that gave me a really good structure. It goes through the definition, the pathophysiology, the signs and symptoms, and then a little bit about investigations and management as well. So depending on how much you need to know for that particular topic, those videos might be, 8 minutes long, but they cover a whole lot of content in those 8 minutes. So I would spend a good half an hour or so actually going through the video, making notes on each particular point of the video. And that really gave me a good basis. And then I would compare it with the objectives that we had. And then I would just check to see if there were any gaps. So anything that the video missed that I need to know about. And I would also just double check things like the investigations and the management, because osmosis is, I think, an American source, and so sometimes the management and things can differ, and also the definitions can sometimes differ with UK sources, and so it's a good idea to just double check. And so to plug the gaps, I would usually look first in the Oxford Handbook of Clinical Medicine, which is just an essential, isn't it, for all clinical students. I would definitely keep that with me at all points in my bag. And then I would also sometimes go onto the internet and look at websites like BMJ Best Practice or Medscape. Some people I know use patient.info as well. The NICE website is also a really good place to go for, especially if you're doing like a primary care placement. They have really good detailed information on what happens in GP in terms of which exact investigations to do and how to act on those investigations. Another really great resource, if you can have access to it, is asking your seniors if they've got any notes, because oftentimes they're going to be aligned to the learning objectives that you need, and they're going to have great sort of little exam advice bits in there as well sometimes, and they're really specific to what you need to know. So the reason why I put a lot of emphasis on watching these osmosis videos and stuff like that is because they give you a great background in understanding pathophysiology. And pathophysiology is really, really important, I think, to understanding conditions and being able to retain a lot of knowledge. So if you can really understand what's going wrong in the condition, which is the pathophysiology, then you can kind of figure out the signs and the symptoms and how it would present, and therefore you're not just memorizing knowledge, you're actually able to understand it, and therefore you can retain it a lot better. So whichever method of studying you choose to go by, there are so many flying around these days. I really like to keep it simple. Usually if I'm not feeling motivated to study a particular topic, I won't do it that day, and I will do something else that I feel motivated to do. Obviously you have days where you don't feel motivated to do anything, and you kind of have to just force yourself to do stuff. So I would kind of just end up doing past med questions in my bed, but that's still something, isn't it? But if you're really just fired up one day and you're like, I need to know about hernias, I need to learn about hernias today, it's just the day, and you have timetabled that you were going to do some respiratory that week, go do hernias then. I mean, you're going to be most effective when you're motivated, aren't you? So you might as well just swap the topics around. As long as you can hold yourself accountable and make sure that you get the topics done that you need to, I think it's much better to be enjoying what you're learning in that moment. So just some wise words to leave you with. It's a marathon, not a sprint. If people seem like they know loads of stuff, I promise you they don't. And if they do, well then good for them, but you don't need to compete with them. All you need to do is get enough knowledge and skill to be able to get to the end and say that you're going to be a good doctor, right? That's the aim. It's not getting 100% on your exam, because that's just almost impossible. So take it slow, work in manageable chunks. If you start to get overwhelmed, go back to the drawing board, have a look at your structure, and sometimes taking a break can be just as productive as working. So I hope that was useful. I just kind of felt like sitting down. It was a nice weekend. Someone singing my Lord, kumbaya. Oh dear. Goodbye world.